For my topic, I was given cranial nerves. The cranial nerves are identified in 12 separate pairs by number, name, and function. Starting at the number 1 spot, we have olfactory, which is sensory, and its main function is smell. At number 2, we have optic, which is also sensory, and its function is vision. At number 3, we have ocular, which is motor, and its function is pupillary reflex. At number 4, we have trochlear, which is also motor and pupillary reflex. At number 5, we have trigeminal, which is both motor and sensory, and its main function is sensation from the face and the teeth. At number 6, we have abducens, which is motor and pupillary reflex. In the number 7 spot, we have facial, which is both sensory and motor, and the main function is the facial muscles and taste. At number 8, we have vestibulocochlear, which is sensory and the function is hearing and balance. Number 9 is glossopharyngeal, which is both sensory and motor, and the function is control of swallowing. At number 10, we have vagus, which is also both sensory and motor, and its function is regulation of visceral organs such as your heart rate. And at number 11, we have accessory, which is motor, and it controls your neck and shoulders. And lastly is hypoglossal, which is also motor and controls your tongue movements. I did an article on the cranial nerve involvement among COVID-19 survivors. I chose this article because it focuses on the impact of COVID-19 on cranial nerve function. It highlights persistent neurological symptoms in survivors, and I feel that some people may be unaware that cranial nerves are affected by COVID, because I personally am one of those people. I had no idea, so I thought it would be interesting. For my first couple key findings, I found that the olfactory nerve was the most affected. So the background of my article is that it was a look-back study that took place from March to July in 2022. It involved 98 patients that had the average age of about 40, and about 1 in 5 patients experienced problems with their sense of taste, which proved that the olfactory nerve was the most affected. And it was often that the problems with the taste was the first or only symptom when testing positive for COVID. And my second finding was that other nerves were involved as well, such as the facial and glossopharyngeal nerves, so it just indicates multifocal cranial nerve impact. Some other key findings was that there were persistent symptoms after recovery, meaning that symptoms lingered for months after infection. Even if you were negative for COVID, you were still experiencing these symptoms. And I found that it was clinically relevant because it is important to screen cranial nerves in post-COVID patients, and it may prevent complications with early intervention. And for my final findings and conclusion, I found that there was some need for further research because some mechanisms of cranial nerve involvement are still unclear, and some future studies could improve treatments and rehab for COVID or even some other issues that people are experiencing. And I concluded that any cranial nerve can be involved in COVID, but the main cranial nerves that are affected are 1, 3, 6, and 7. So yeah, thank you for listening, and here's my citation.